Let's continue talking about blood vessels. We are going to speak of the blood vessels below the diaphragm. So what we see right here in this very basic schematic is the diaphragm, liver, right kidney, left kidney, spleen. The big, long descending structure is the descending aorta, specifically the abdominal aorta, which is going to bifurcate once it reaches the pelvic cavity into the right and left common iliac arteries, which are going to bifurcate yet again into the right external iliac artery, right internal iliac artery, and on the left side, left external iliac artery, and the left internal iliac artery. The external iliac arteries will give rise to the femoral arteries. That is to say, it's the same blood vessel. It just, the name of the blood vessel has a name change once it passes through the inguinal ligament. But going back to the main part of the aorta up here, we're going to look at a number of blood vessels coming off the ventral surface of the aorta and a few coming off the side. Specifically coming off the side, we have the right and left renal arteries going to the kidneys. The first blood vessel coming off the ventral surface of the aorta below the diaphragm is known as the celiac trunk right here. Anytime we use the word trunk, that is going to suggest that blood vessel is going to split or divide somewhere downstream. And it does so immediately with regard to the celiac trunk. The celiac trunk has three branches: the common hepatic artery going to the liver, the splenic artery going to the spleen, and the left gastric artery, which is going to the lesser curvature of the stomach. Once again, the celiac trunk gives rise to the common hepatic artery, splenic artery, and the left gastric artery. The next blood vessel coming off the ventral surface of the aorta below the celiac trunk is going to be the superior mesenteric artery. And then we're going to find the inferior mesenteric artery. So celiac trunk, superior mesenteric artery, inferior mesenteric artery. These two bilateral arteries right here are the gonadal arteries, right gonadal artery, left gonadal artery. If this specimen was female, we could call these the right and left ovarian arteries. If the specimen was male, we would call them the right and left testicular arteries, or merely the gonadal arteries. Looking at this image right here, here's the celiac trunk. This would be the common hepatic artery, left gastric artery, splenic artery, superior mesenteric artery, inferior mesenteric artery, right gonadal artery, left gonadal artery, right common iliac artery, and left common iliac artery. This, by the way, right here is the inferior aspect of the diaphragm. And here's another good view of the celiac trunk right here. The aorta immediately piercing the diaphragm. We get the celiac trunk. Here's the left gastric artery, which is providing blood to the lesser curvature of the stomach. This right here is a splenic artery going to the spleen over here. And once again, this is the common hepatic artery giving rise to a number of other arteries going both to the liver and to the duodenum and the greater curvature of the stomach. But for our purposes, let's just focus on the common hepatic artery with regards to all of these blood vessels. And here's another view of all of this: celiac trunk, common hepatic artery, splenic artery, left gastric artery, superior mesenteric artery, and here's the left gonadal artery, right gonadal artery. Can't see the inferior mesenteric artery on this perspective, but one thing I do want you to notice is this is the inferior vena cava. As anywhere in the body when we have arteries, we have veins accompanying those arteries. Certainly the blood in those vessels are moving in opposite directions. Right here is a hepatic portal vein providing blood to the liver. And this is blood that has actually picked up nutrients from our small intestine and it's going into the liver to be filtered, detoxified, cleansed before it gets into the inferior vena cava, up to the hearts, and into the general systemic circulation. Here's another view of all of this: celiac trunk, superior mesenteric artery, inferior mesenteric artery, gonadal arteries, right common iliac, left common iliac arteries, external iliac artery, internal iliac artery, and same on this side. We can see the same with the veins: right external iliac vein, right internal iliac vein, right common iliac vein, left common iliac vein, left internal iliac vein, left external iliac vein. The two common iliac veins will drop their blood into the inferior vena cava. One thing I want to show you right here, we looked at the gonadal arteries. There is an asymmetry with the gonadal veins. That is to say, this is the right gonadal vein dropping into the inferior vena cava. The left gonadal vein drops into the left renal vein, and then from there, the blood enters the inferior vena cava. To be clear, if this were male, this would be the right testicular vein and left testicular vein. If it were female, as is shown right here, this would be the left ovarian vein and the right ovarian vein. In both cases, regardless if it's male or female, we could call those both gonadal veins. Here I want to show you the hepatic portal vein, which we see right here, which I alluded to earlier, which is picking up nutrients and digestive products that are going to move through the liver prior to moving into the general circulation, and it's going to do so via the hepatic portal vein right here. All of these veins right here, superior mesenteric vein, inferior mesenteric vein, splenic vein, all of which you do not need to know, are dropping into the hepatic portal vein. As we see right here, here's the hepatic portal vein running right along with the common bile duct. The hepatic portal vein brings blood into the liver to be cleansed and detoxified. And then once that has happened, that blood is going to leave the liver via the hepatic vein and drop into the inferior vena cava. So just so we're clear, there's a hepatic portal vein entering the liver and a hepatic vein leaving the liver.